Hi, I'm Dr. Ashkenazi. I'm here at the Coral Springs Disc Center in Coral Springs, Florida, with a patient of mine who just finished knee treatment, and his name is Mr. Wesley. Just to explain the knee a little bit, so the knee joint is a little bit of an unstable joint at times, in that you have the kneecap, people call it, or the patella floating here. You have ligaments in the front, ligaments in the back, ligaments on the sides, and then you have a meniscus in between the bottom leg bones and the upper leg bones. So this knee is supposed to work very smoothly and evenly. The problem is when there's injuries to meniscus or to any of these ligaments, it can create what's described as a grinding type of situation. We call it crepitus. Very uncomfortable, causes a lot of wear and tear in the knee. Eventually you'll wind up with bone on bone if you don't correct this. And that ultimately will lead to knee surgeries, knee replacements, injections with cortisone, and just a lot of headache. So we try to keep these knees healthy and stable and working the way they're supposed to, and that's what we're going to talk about today a little bit. Now, when you first came to me, how bad was your knee on a scale of 1 to 10? 10 is the worst.
Oh, 10 is the worst. I'd say about 8.5.
Okay, so that's pretty significant. And you like to work out in the gym?
Yeah.
And you like to play basketball?
Yes.
And obviously that was a problem.
It became a problem. The pain pills no longer were as effective as they were starting off.
Yeah.
That's when I knew it was a problem.
And the problem with these pain medications, which so many people take, is they may help alleviate your symptoms, but they're not correcting the problem. So what happens is you don't feel pain, you go back out there, you go to work, you go to play, you do whatever you do, and you're making the situation much worse. And then when the pain medicine wears off, now you're in big trouble, right? Big problems.
Yeah, I knew if I had to keep taking the pain, I wasn't going to like that. So I needed to find out, and I saw the ad.
That's right. So
I said, well, let me give it a try.
There you go. And you came in and you went through 5 weeks of treatment, 3 times a week, right?
Yeah.
And was it hard to do, the treatment?
No.
Was it painful, the treatment?
Interesting, though.
Yeah. Was there any pain involved?
At first, I was a little skeptical when it talked about the knee being pulled, the leg.
Yes.
I just thought that it was going to get pulled off or something. But that's just how we think about the worst.
Right.
First.
Yes,
but
this is true.
As we went through it, it went well.
Okay, and you had no pain during the treatment, or did you have any pain?
No.
Okay. The treatment itself is very easy to do. We use non-surgical knee decompression. It's a machine that you sit in. It distracts the knee, releases, distracts, releases. What it's doing is bringing in the body's own natural fluid to help heal the cartilage, heal the area. And we combine that with laser treatments, with electrical muscle stimulation, with supplementation, with knee supports, and of course with adjustments when we think necessary. This is the formula that gets people well without drugs, without needles, without surgeries. And now you're talking about you're back in the gym?
Back in the gym, back on the court by myself.
Okay.
I'm not playing with anybody else. I got to drop some weight, condition.
Okay.
Be back at it.
All right. So the question for you is, would you recommend this for anybody out there that has a knee problem?
Highly recommend.
Okay. And
at least to find out what's wrong. I didn't know what was really going on. So I had to find that out.
So if I find that it's something beyond what we can handle, I will get you out to the right physician that can. But 9 times out of 10, in most cases, it's something that we can get to A, get your quality of life back, B, get your knee functioning the way it should, and C, making sure that you don't need surgery anytime soon. And that's the idea. I've had people that have been told they need knee replacements, and we've been able to prolong that from being done. I've had people with tears in the knees. We've corrected that and made them better. Generalized pain, inability to walk properly or to work or to play, and we've corrected all that stuff too. So it's something that if you have any questions, if you're uncertain about what to do with a knee, give us a call, 954-346-5750. I am Dr. Ashkenazi. Everybody calls me Dr. A. That number again, 954-346-5750. We're here in Coral Springs, Florida. Happy to answer any questions you have. Thank you, sir, for being a great patient.
You're welcome.
And we just spoke about perhaps continuing once a month. So when you are playing ball, we can continue to keep that knee in good shape with no injuries or aggravations. And that's the idea.
I don't want that, That'd be good.
All right. So once again, give us a call if you have any questions. We're happy to answer that for you. And we're happy to hear from anybody that has a question. So thank you. And we'll see you soon.